Hello, welcome to my presentation. My name is Christina, and this presentation will be on mental health, specifically understanding the different perceptions and treatments globally on mental illnesses. The first topic that we're going to be talking about is mental health issues, really understanding the background on mental health illnesses and what they really are. As defined by Merriam-Webster's English Dictionary, a mental illness is an impairment on normal psychological functioning that causes a significant distress or disability on the individual or patient. These mental illnesses therefore manifest differently in different cultures, which is what we were going to be unpacking in the next couple of minutes. The next point that we're going to talk about is the perceptions on mental illnesses and understanding the cultural differences in the understanding of mental health. One of the ways that we can see this is very strictly understanding Western societies versus Eastern societies and how they view mental health and mental illness. Western societies tend to reflect more on their behaviors, explore inner emotions, and require a greater amount of explicit social support, while Eastern societies tend to distance themselves from others and show a greater privacy of emotions due to a taboo that is more present in Eastern societies, which is why they thrive off of a more implicit social support system. Our next point is cultural influences. So understanding how the examples of cultural impact on different societies. So how do cultures really impact mental illnesses? We see this present in three ways: prevalence, manifestation, and experience. We understand in global psychology a culture-bound syndrome, which is specific to a specific region, which is an example of hikikomori in Japan. Moreover, it's necessary to understand that they arise from culture-specific values and customs, which therefore affect how they manifest in different societies and the prevalence of them, and of course impacts the treatment because of the way that societies experience and understand different mental health illnesses. In this slide, we can see how rates of depression really differ worldwide. In more Western societies, we see higher rates of depression at 6.5%, while non-Western societies or less modernized societies have much lower rates, more at around 2%. Next point is differences in treatment, so understanding the alternative methods of treatments globally. The idea of social support and therapy is something that is pretty well known worldwide and is a common practice. However, in Western societies, we tend to see more of a medication or psychoanalysis approach, which is a lot more clinical. And in more indigenous societies or Eastern societies, we see more of indigenous healing and an approach on spirituality to heal mental health illnesses. So the big picture, to wrap it up, what does this mean in terms of psychological research and our cultural conscious? This means that we need to be more accepting of differences in mental health, and we need to have a greater diverse methodology for treating patients in order to recognize cultural impacts and be able to approach all different various backgrounds to treat mental health illnesses. These are my references, and thank you so much for watching my video. Have a great day.